And clearly, we see that the states where there are big cities like Montreal are more affected than regions where there are no big cities because of the proximity of people. And when we look at our neighbors, well, we see that Chicago and Detroit are in the same situation as we are when we look at the number of deaths per million inhabitants. If we look at Boston and New York, they've got twice as many deaths as we do. There is one exception, and that is Toronto, which has fewer deaths than the other big cities in the northeastern U.S. I haven't found an expert yet who can give me Toronto and Ontario's recipe, but we are looking for it, and obviously we hope for them that things continue to go well. Now, all of these states that I just mentioned have difficult decisions to make, and they make these decisions, as we do, following the recommendations from public health and according to the evolution of the number of cases, the number of hospitalizations, and the number of deaths. What worries us currently is the number of hospitalizations. When we look at the evolution of hospitalizations over the past 2 weeks, not 2 months, over the past 2 weeks only, we went from 168 hospitalized patients to 409 hospitalizations. So in 2 weeks, we have doubled. And we know that this virus and its transmission is exponential. That means that if we did nothing, we could think that in 2 weeks we would be at 800 cases in hospital, and in 4 weeks we would be at 1,600 people in hospital. And we've got a healthcare network that is already fragile. I think it's important to repeat that. When we inherited 2 years ago as a government this healthcare network, well, already it was a network that had been neglected by the governments over the years. And I also, on behalf of my government, I have taken my part of responsibility. I've often said this. We had a lot of jobs to fill over the past 2 years, but we did not increase the salaries quickly enough, amongst others, the salaries of patient attendants, which means that there are many positions that were not filled. So that is the network that we have currently. And we must tell Quebecers the truth. If the number of hospitalizations continues to double every 2 weeks, we have a true risk of overloading the system. What does that mean? Surgeries, important surgeries will have to be delayed. We will not be able to, in reasonable delays, to give health care to all Quebecers. So that is my obsession. That is the health minister's obsession as well, to save the healthcare network. And that is why we have made difficult decisions over the last few days. And I'm telling you, we are trying to do so. We do our best. I'm trying to make the best decisions following public health's recommendations. How can we save the healthcare network? That is what has brought us to say that for a certain amount of time, we are closing restaurants in the red zones, bars, certain sports activities, theaters. We had no choice. I wasn't happy to do this. Nobody was happy to do this, to shut down these businesses, especially since a lot of people had made a lot of efforts this summer to try to comply with public health measures that we had implemented. So you have to understand that the situation is exceptional. So we have exceptional measures. These closings, we had no choice. It was to save our healthcare network. Now the schools. In all of the decisions that we make since the beginning, we are trying to do two things: protect the schools and protect as much as possible the jobs of Quebecers. If I come back to the schools, yes, we announced mandatory masks in high schools, and you can see the dilemma that we've got. We've got people who say, you should have done it earlier, and we've got other people who say, you are sacrificing a generation. So even if we wanted to try to please everybody, it is impossible, because there are some people who say that we're going too far and others who say that we're not going far enough. So I don't know how to please everybody. And quite honestly, my objective is not to be popular. My objective is to save the healthcare network. So my message today is very clear. Let's stay home. We go to school, we go to work, but otherwise, stay home. I'm convinced that we are able, as Quebecers, to break the second wave. Now is not the time to get discouraged. Now is not the time to be negative. So I'm telling everybody, courage, and thank you for your collaboration.
Good afternoon, everyone. The increase in hospitalization continues to be worrying. The number of hospitalizations has doubled in 2 weeks. Our health system is already fragile. If we continue in the same way, there's a risk that we won't be able to treat every Quebecer that needs it. That's why we've had some tough decisions to make in the last few weeks. We must protect our schools and our economy as much as possible. I know it's tough, but we don't have a choice. We need to stop the contagion, and to do that, we need to reduce our contacts. That's our goal right now, not to be popular, but to save our health system. So my message is clear and simple today. Please stay home. You can go to school or to work, but otherwise, stay home. Courage, everyone. We'll get through this. Thank you.
Merci, Monsieur le Premier Ministre.
Thank you, Mr. Premier. We will begin the question period. Question? Gentlemen? The 28-day challenge, is it still realistic, Mr. Premier? Listen, that's what we're hoping for. We hope that we will break the wave. We are prudent. Today, we went to 900 cases. We had 1,300 yesterday. Does that mean that we will soon reach the peak of the second wave? Maybe tomorrow the numbers will go up again, so it's too soon to tell. Is it realistic that by the 28th of October, we will have broken the wave? It's possible, but maybe not. Unfortunately, I can't answer that question. Furthermore, the official opposition this morning said that Quebecers no longer trusted your management of this crisis. And perhaps that's why you constantly repeat your messages. What do you think? Are the Quebecers still listening to you? I think that Quebecers, for the past 7 months, have demonstrated their trust. I never take it for granted. What I'm trying to do, I do it to the best of my knowledge. I try to work hard and to make the best decisions possible in the interest of Quebecers. And as I said, my objective is not to be popular, it's to save the healthcare network, because our health network is at risk currently. So I'm making the decisions, even if they are unpopular decisions, specifically on the cultural side and with sports. But we have to try to protect the activities in the schools and for a certain number of people who work in conditions where there's not too much contact. Question? Hello. Mr. Premier, you brought this up. The delay of services is at our door. And what's worrying now, and perhaps the health minister can confirm this number, there's around 140,000 surgeries that have been delayed. Some have been delayed for more than 6 months. How much time will it take to catch up? And what is a message to tell people? What do you have to say to the people who are waiting for their surgeries when you tell them that there will be some more surgeries delayed if we don't break this wave? Well, actually, this is what we've been telling you for the past few weeks. We're quite transparent. The number that you're talking about, we now publish the number of surgeries that are on the waiting list. This is available on our website. So what I'm telling you is that we do not want to have additional delays, but we may have no choice if we continue. If the cases continue to go up and that the hospitalizations continue to increase, we will have no choice. Our choice is to try to disrupt as little as possible the situation in hospitals, to try to minimize the impact. I'll give you an example. We must be very targeted when it comes to delaying. That's what we discussed with our CEOs over the past few weeks. What does that mean? Well, if we must stop or close down one operating room in a hospital, we will close one, but not all 5. We must be able to have this discussion. And I think that we're very transparent. We had these discussions with our CEOs in the past few weeks. I put it in the plan for the second wave. There were going to be some delays, and these delays, it's important to establish priorities so that it hurts as little as possible. But if the trend continues, we will have some delays, but we are trying to make them as... We want to continue with the urgent operations, but we'll have to make some choices over the next few weeks. That was clearly in our second wave plan, and I think that Quebecers expect that we get ready for this because it's possible that it occurs. Mr. Premier, the Chief Ottawa made some declarations over the past few hours, and he said that you've got an appointment with history, and you will miss an opportunity if you don't recognize systemic racism. He even said, you compare it to the situation that's happening in the U.S., but he reminds you that Aboriginals, several of them live on reserves. Well, it's important to specify that I met Chief Ottawa this week. I even asked him if he wanted me to go to the funerals, and he said yes. Unfortunately, the family, and I can understand, the family preferred that the Premier not be there. And that's the family's choice. But Chief Ottawa and the Grand Chief of the Atikamekw Nation wanted me to be there. During this meeting, we talked about why we believe that it's not a good idea to have a war of words. What I want to do, I don't want to have a war of words. I want to fight racism. I want a war against racism. And if we want to have the support of all Quebecers, well, we've got on the one hand a group of Quebecers who says there is systemic racism, but there's another group of Quebecers who says, wait, I see this as being an attack against the Quebec people. If we want to be able to bring people together, not divide Quebecers, but bring them together, everybody says that there's racism. Everybody wants it to stop. Let's act. And I've offered to Chief Ottawa and to the 3 other chiefs who were there from the Atikamekw Nation, and I also invite all of the other nations to work together on the Vien report, on the fight against racism in the different networks. So let's work on actions instead of having a war of words. Question? On systemic racism, I was wondering, the debate, is it finished within your caucus, or do you still discuss it? We're always open to discussing it, but the position of our party, of our government, has not changed. We consider that there is no systemic racism, but there is racism, and we want to be the government that will have done the most to fight racism. Why do you maintain this position? As I said earlier, there's a significant group of Quebecers who agree with our position, and they say it's not true that there's a system of racism in Quebec. And they even take it as an insult to the Quebec people. The Quebec people are not racist. So we have to be able to bring together the group of Quebecers who think that there's no systemic racism with the group that believes that there is systemic racism, and to make them work together to fight racism. And I'm repeating myself. What I want is not a war of words. It's a war against racism. Question. You talked about Toronto's recipe, Ontario's recipe. Yesterday, Mr. Dubé said that perhaps one of the reasons why Quebec is not performing well currently is that Quebecers are perhaps less disciplined than Ontarians. What do you think about this? Do you think that Quebecers are not disciplined in the second wave? Well, listen, we've got the original six in hockey, right? But we've got Chicago, Detroit, Boston, New York. They're all in the same place or worse off than we are. There's one exception, and that's Toronto. Now, Quebecers, are they like the people from Boston, New York, Chicago, and Detroit? Well, listen, we're speculating here because what's the difference? I'd like to know. I'd like the answer to that. Do you think that we're less disciplined? Well, listen, I know that there are some people who agree with that statement, and others are not in agreement with the statement. We had spring break at the wrong time, okay? So we started with more cases, and we always had more cases. Even this summer, when we were at the lowest point, we were not as low as Toronto and Ontario. So obviously, if we start here instead of starting from here, well, when things double every 2 weeks, well, it's going faster and it's going further with us than in Ontario. Mr. Arruda, Mrs. Drouin earlier in Montreal was saying that, yes, a majority of the cases is in the 18 to 34s, but there was an increase. It's doubled for the 65 and ups. Not necessarily in the CHSLDs, but in residences for the elderly. Could we see a tightening of the measures for the 65 and up? Well, we have to understand that it's not because right now it's young people that are impacted. This transmission, this community transmission, will infect other adults who will infect grandparents. So I want to tell you that the most important thing, if we want a simple message, is truly the 2-meter distancing, wearing the mask, washing the hands. This is what has decreased. This has decreased currently. And now is not the time to go have supper with the grandparents right now because we don't know if we're infected or not. We've got Thanksgiving coming up. Let's not go visit the grandparents because that is what is currently happening. And these grandparents are also in the community. They can expose other people. And these are the people that will end up in the hospital, in intensive care. And unfortunately, some of them will die. Currently, the people who are dying are all from 70 to 85 or more. But that doesn't mean that since the virus is present in the community, we have to find the means so that people are not exposed to this virus, especially for these people. And that means hospitalizations and often death. Question? Mr. Legault, do you regret having opened too much in the summer? Well, this is what I was saying to you earlier. There are some people who think that we open too much and some think that we don't open enough. I think the situation this summer allowed us to open up a little bit more, but now the situation is more difficult, so we have to close up some more. And I invite you once again to go see what's being done elsewhere. All the states in the world are doing this. Now, for the hospitalizations, the number is increasing. What kind of detail can you give us as to these 400-something hospitalizations? Are there some people who are hospitalized but who are more in isolation, waiting to be better before they go back to their residence? Or these 400 people, who are they exactly? The analysis of the people who are currently hospitalized, these are mainly people who came in over the past few days. But I would tell you that what's important to remember is that the number that we publish every day, it's a number that is net, right? I'll give you an example. Today, if we have 12 additional cases, perhaps 25 came in and 13 left the hospital in the same day. And that's important to remember because that means that the volume, and we can give you this information because when we had something stable, right, like what the Premier was saying this summer, well, perhaps it was +2, -2, but now the volume is starting to be more significant in the increase. So that's the first part of my answer. What we're seeing currently is that people who are hospitalized, mainly they're young, but there's an aging of that population. And I think that what we'll be able to tell you is that that's what we're following the most, is how is it evolving? Because we know that young people, take longer, or they can get through the virus, but when they're sick, they are truly sick, and they can be there for a long time. And that is the second reason that worries us, and that is what we are following very closely right now, because imagine that we have younger people in hospital and that they stay for a longer period of time. Well, we've got an even bigger problem. So young people who go into the hospital today can stay there longer, and that could have an even more dramatic effect. So yes, they've got better chances of getting through it, but at the same time, they can stay hospitalized longer, which really hurts the health care network. But I can tell you in summary that those are the two main issues that we've got. Question? Mr. Dubé, during the first wave, you weren't there yet, but we had hired volunteers through Je Contribue to go into the CHSLDs. Could we do the same thing, but for hospitals this time? Well, listen, I would tell you that the good news, because I'm not going to talk about the first wave, because we succeeded in using these people during the first wave, and that is what brought up the whole question of patient attendance. So I think that this was a nice success. When we called upon with Je Contribue a couple of weeks ago, we've got a different challenge. I told you that one of the places where we can truly improve and which will have an impact, well, the screening, I think that that's under control, but now it comes to contact tracing. You'll remember what I explained to you is that in contact tracing, once we have identified somebody who is COVID positive, we have to contact trace as quickly as possible to control the outbreak. Now, this staff that we're missing, I would tell you that we're still missing at least 500 people, and I'll explain to you. We had 800. With the first people who called us over the past few weeks, we've hired 400 people. We're close to 1,200 people now, but I've explained to you that we needed approximately 2,000 people. 2,000 people to be able to do better work on contact tracing, because, as I said, the number of outbreaks has more than doubled over the past 3 weeks. We are now, the latest numbers, now we're at more than 600 active outbreaks. Well, 600 outbreaks in our two main regions, our red zones, we need a lot of people to do some contact tracing. Our biggest challenge, and I'll finish with this, that we had a lot of people who answered, but now we have to train them quickly. Because I'll give you an example. I've got a police officer who says, I can help you to do contact tracing. But when he calls the person and he says, what's your name? Who did you meet over the past few days? That's our day-to-day contact tracing. The first person or the first question, they're going to say, well, what do I do if I have a headache? The police officer can't answer that question. So now we've got an issue over the next few days. We have to train these people and so that they can help us, not only in contact tracing, but they have to give the right answers to people. So currently, Mrs. Savoy, my deputy minister, is saying I've got a good pool of talent, so Quebecers answered the call, but now we're looking at how to quickly train them. And you saw, we did it quickly with the patient attendants last time, and for me, this is truly what we're working on over the next few days so that we can increase, so that we can grow the tracing team and do a better job to contain our outbreaks as quickly as possible. Mr. Legault, I'd like you to explain, in your opinion, what are the differences between the terms systemic racism and discrimination, systemic discrimination? I'm not going to get into that. I don't want to have a debate on words. Is there a difference? Yeah, there's a difference. Question? Mr. Legault, you said a few days ago, or a few weeks ago, that the last thing that we want to close is schools. Given the situation and the data that is worrisome, is it possible that we will close the schools? Can you imagine scenarios that would make us close schools? No, there's no scenario to close the schools. On the state of staff in hospitals, Mr. Dubé, you said that we're missing people, missing staff, nursing staff. What is the state of the situation now? What's the rate of absenteeism? People who didn't come to work because they're sick, etc. Do you have any idea? A bit over 6,000. You'll remember at the worst of the wave, we were at a little over 12,000. And we managed to decrease that number in the summer at around 4,000. So we brought back nurses that were on leaves. And over the past 6 weeks, we went back up to 6,000 approximately. And that is what we have to be extremely careful with, because that is where the system is very fragile. We do not want to find ourselves again to need to bring in all sorts of people who are not trained. So that's why we insist every day. We are asking Quebecers to put less pressure on our healthcare system. And I'm repeating myself, I don't have Dr. Arruda's expertise, but I'm going to tell you my own words. The actions that we do today, when we respect public health measures, will have an impact in 15 days. Every gesture, the day that we say we're meeting one less person, when we respect the 2 meters, when we are careful and we wash our hands, each one of these actions, if on the weekend we don't invite our good friends over, each one of these actions will have an impact in 2 weeks. My greatest wish over the next few days is that we be able, because we already started 8 days ago, would be to see in the next few days a stabilization of our cases. Just that. And not just one day, like the Premier said. That's why we look at a rolling average or moving average. I don't want to get into details, but you know what I mean. It's when we take an average of the past 7 days. The average of the past 7 days is 1,000. If we were able to stay like that for a few days or even a few weeks, well, the second step would be to see a decrease in the number of cases. So to answer your question, the best thing that we can do for our healthcare professionals is to show that Quebecers want to protect them. And if we do this by respecting public health measures, well, I think that people in the healthcare network will appreciate the fact that Quebecers know that they're important. Question? You're saying that now is not the time to be negative, now is not the time to be discouraged. One of your challenges is also to maintain the buy-in of the population when it comes to your decisions, to make sure that they respect the measures. You're repeating again today that your decisions rest on recommendations from public health. Dr. Arruda recently was telling us that he was open to the possibility of making public his recommendations, even if sometimes, even certain emails, even if they're short. So why not make them public? Like the opposition parties are asking you to do, the population perhaps would better understand what your decisions rest on. Because in practice, it doesn't work that way. Most of the decisions were discussed. So we start with data, with cases, in a more detailed manner, sub-region by sub-region. We talk about measures. Sometimes there can be measures, we have the choice of 2 measures that will give us about the same result on the reduction of contact. So these are discussions that we have. We have them quickly, and we listen, we hear the recommendations, we have a debate, we discuss. But up until now, we have managed to agree on the measures. Earlier, you gave the example of other big cities, American cities, where things are worse than here in Quebec. Let's take the case of Montreal today. There's 130 outbreaks, 42 in school settings, 18 in daycares. That's around 60, just these 2 elements. There's 50 in workplaces. You told my colleague that you do not plan to close schools. But will you reconfine other sectors, other workplaces perhaps? We're not there for the time being, but what I'm telling you is that the last place that we will close is schools. Listen, look at what we did. You saw in the spring, the shops that are not essential or the businesses that are not essential, we close them. So there's a progression. But what I'm telling you is that what we want to protect is the schools and some jobs as much as possible. But all the other activities that are not essential, well, I'm asking people, and I'm talking about the red zones here, I'm asking people to avoid these non-essential activities. Question? If you'll allow me, I'd like to thank you for letting me speak, but the situation is critical, but it's not we're not desperate. People need to understand it's critical, but there's still a way to break this wave, but it's going to take a collective effort. You know, we can do closings, we can act with the population, but what drives the epidemic right now is social contacts between individuals in all sorts of environments. And if we want to succeed, the first thing we have to do is people who have symptoms must be screened and they must self-isolate before they contaminate others. If we're in contact with a positive case, we also have to self-isolate and wait for public health to call. Public health will call and give you recommendations. And the rest, where is it? I will tell you. Yes, we can close everything down if we want. New Zealand closed everything to eliminate the virus. But we don't want to get to that point. But I will tell you that it's in the community that the virus is being transmitted. So, in fact, the recipe is not necessarily to close this place or that place. We've done this because it's an incentive it's an incentive. That's where there are more social contacts. We want you to decrease your social contacts. If all Quebecers decrease their social contacts significantly, we will see 10 to 14 days later the effect that it will have. The measures that we've implemented, we will see the effects in a few days, but we need to intensify. If you don't want us to close other environments, decrease your social contacts. Go to work, go to the grocery store, go shop for something if you need it, respect the 2 meters, wash your hands, and wear a mask. That's the message. And be careful with our elderly, because so that they don't end up in the hospital. I want to tell you that the situation is critical, and it depends much more on individual behaviors than closings. Question? Mr. Premier, Judge Vien studied the whole question that you mentioned earlier, the 2 camps that you talked about. He came to a conclusion. He said in Quebec, there is systemic discrimination. He explained exactly what it was. He gave very clear instructions on this. You said earlier that there's a difference between racism and discrimination. Now, if you don't recognize systemic racism, do you recognize systemic discrimination? Currently, we're looking at the 142 recommendations from the Vien report. We want to apply as many recommendations as possible. I can't say more than that. But if you say that there's a difference, does it become more acceptable to use the term systemic discrimination? Listen, like I said, we did not discuss this. What we're saying, however, is that for us, there is no systemic racism. For Minister Dubé, on placement agencies, I'm sorry, it's inaudible. The answer is yes. First of all conflicts of interest, for me, regardless at what level of the organization, it's unacceptable. What I understood over the past few hours is that it was impossible for senior executives to have a conflict of interest. It was clear that senior executives could not have any stakes. But there was, over the past few years, there were some executives, or middle management, they could, according to certain CIUS, have this flexibility and this possibility. And for me, that is completely unacceptable. We cannot say that because we're at one level of the organization that we can have a conflict of interest or a perception of a conflict of interest. So what I asked, clearly, over the past few hours, I asked my Deputy Minister, Mrs. Savoie, to make sure that she finds out. Now, the known case, we know it, of course, but to see everywhere where there could be these conflicts of interest, there will be guidelines that will be sent in, and it will no longer be allowed regardless of where people are in the hierarchy of the healthcare system. We will now go to the English questions.
Good afternoon. I wanted to start with the 28-day challenge. Seems more and more irrealistic. It seems unrealistic. And I'm wondering if you feel like you need to hold back and give a hopeful message to Quebecers. Stay with it. At the end of the 28 days, we're going to get through this. But realistically, we need to keep limiting our social contacts. If we reopen at the end of 28 days, we'll just go back to where we were before. So it's not just 28 days. We need to keep this until, I don't know, until when?
Well, I'm so glad you asked the question. So glad. I'll do it in 3 steps. Let's be clear, and I said that in French earlier, and if you don't know, I'll repeat it. We can make a difference every day. When we announced that on October 1st, officially, right, we said October 28th, we can make a big difference. The last effort of the last 7 days will pay off in the next few days, because you know that the gesture, the way we react, the way we apply those measures will have an impact in the 14 days following. So what I'm commending the Quebecers is we'll see in the next few days if our tough measures and the way we have been reacted are paying off. That's for the first 14 days. And the vision we have with the expert is the first success, and we need some success. The population, when we call that, we need win. We need some, sometimes we say low-hanging fruit. We need to have a win sometimes. And the win that we can have in the next few days is really to stabilize the number of cases. If we were able not to go as we've seen, 600, 700, 800, now we are in the 1,000 area. If we could just see a stabilization of that number in the next week, that would be a first win. That would be for the first 14 days. And then the Quebecers will say it's working, right? The second win would be if we continue over the following 14 days, can we see now a decrease? And I'll tell you, when it goes down, and we have experts that are analyzing that, it makes a big difference, because when you start to see the diminution, the decrease, of those, the outburst of being at 600, they would go down to 500, 400. I think that would make a big difference. So I don't know where we're going to be at the end of October. But I know one thing, if we have those 2 wins, the stabilization first and some of the decrease in the second part of October, to me that would be a very big win. And we'll give you this information because, as you know, what I think is clear, and I'll finish with that, is all those gestures, all those things that we do right now will have a big impact in the next 2, 3 weeks, 4 weeks. And what we will do in the meantime is update you every week, as we did last week, what is the impact on hospital and how we are managing our hospital system. If Quebecers, and I think they understand that, we will keep them, we'll inform them of the benefit of succeeding in the next few weeks. And I'm saying, as I said before, let's make sure we show to the nurses and all the personnel in the hospital that we are doing that for them. Because if we're successful in our health system, we can continue to have our kids at school, and we can continue for our people to go to work. That's really the 2 success that we would like to have in October.
My next question is about family doctors in Montreal. They say the number of PREMs, I'm not sure how to pronounce it in English, PREMS, being offered for 2021 is not enough because it still leaves some neighborhoods underserved. How is your government planning to fix the system by which Quebecers get a family doctor so that there isn't such a shortage?
Okay, you want me to take that? Okay. Le PREM is really the system where we allocate in each region every year roughly 900 new doctors that are coming, and basically we think that currently we have two issues. We have an issue how we allocate each time at university, how we allocate between specialists and generalists, and we are promoting more generalists because we think this is what we need more. So that's the first decision that we have made in the last few years. So I think they should be happy with that because that's the priority that we want to give. That's the first thing. The second thing is we think that it's not only the number of doctors, and I don't want to go into a large debate that we will do, but the doctors, especially the generalists, need to work with us better to make sure that in what we call les GMF, les endroits où les gens peuvent aller se faire traiter, we need to have a better service to Quebecers, even though they're not allocated to one doctor. So it's not only a quantum of doctor, but it's a way we allocate that we can service a patient that is not allocated to a doctor. We are discussing that right now. We have made very clear discussion with Dr. Godin of DFMOQ as to how we could serve better within 36 hours the patient, even though they're not allocated to a doctor. And we're working really hard on that. So we're working on the quantum, having more generalists, but we're also working on making sure the Quebecers can call a doctor and have an answer within 36 hours, even though they're not allocated to one.
Philippe Autier, de Gazette.
Good day. I just would like to ask Mr. Premier Legault and Dr. Arruda if you share Mr. Dubé's views that, well, maybe you want to hear the question first, that Ontarians are better at following the rules, they're more disciplined, and that's maybe why they're doing better than Quebec is. You spoke about the Toronto mystery that you would like to understand. Do you share his views that Quebecers are not as disciplined as Ontarians?
But one thing is clear is we have more cases, more hospitalization. So it means more contacts, but it's very tough to answer this question because we started with more cases at the right beginning because of the school break. So it's very tough to answer this question, but I don't know.
In fact, I think it's always difficult to say one thing will cause everything. It's a mix-up of factors. But if we look different polls that have been made, especially by different firms, about the comportement of the Québécois compared to Ontario, there seems to be, as Mr. Dubé said, a little bit of less compliance on things, a little bit of but that's not the only thing that could explain everything. Even there is some hypothesis about different types of virus, which were different source of virus that have been circulated. I think it's too difficult to make a direct causal situation. It's a mixed up of things.
And if I may,
go ahead,
because I will comment on my comment. As you know, sometimes I put myself in trouble, so I'll continue to dig my hole. But the one thing that I've said, I don't know if I said the word more discipline. I don't know the word that I've used, but I'll say one thing.
Mr. Roy says, Patrice Roy says they're more disciplined, question mark, and then you say, c'est possible.
Okay, here we go. Yeah, so I think that clarifies what I said. Okay, good, thank you. Now, having said that, I think what I'm taking the responsibility is not on What is the difference? I think the responsibility that this gentleman gave me is to make sure that it works. We've done a lot of things in the last 3 months, a lot of things. But I'm telling Quebecers that we still have a lot to do. And I'll give you the example. When I want to share that with the Quebecers because I think it's important. The job we have to do, and I explained when we were talking about testing. I told you a few weeks ago, we were not good at it. We were not good at managing the lines. We were not good at answering. And we are improving on that every day. Now, you've seen what we have done. It's still not perfect, but improving. Now, one place where I think we can improve that can have an impact is on tracing. And I've discussed that with our people, with Mylène Drouin in Montreal. And the reason I'm saying that, so I don't know how Ontario is able to do their tracing better than us, but we discussed that the other day. But I know with Mylène Drouin, she's telling me, when Quebecers are not answering my call, when we have identified somebody, that person continue for 2, 3, 4 days to be contagious, that can have an impact on the number of cases. So our job is not to say Quebecers are doing worse or what can we do? And I think on our side, we can improve our tracing system by making sure that we do a better job, and that will have an impact. But what I'm asking Quebecers today, please answer the phone, because you can make a huge difference, because that person, whatever she or he feels guilty, he should not feel guilty. We've said that many times. So the difference, I'll tell you, if we do a better tracing and Quebecers help us in that tracing, in the next few days, we'll make a big difference. And again, maybe we can reach Ontario.
And my second question for Premier Legault, you had a cabinet meeting today. Is it still the plan of the Quebec government to proceed with the school board elections in the English system this on November 1st? Is that still are you still going ahead with the elections?
Okay. Right now, we had a recommendation from the public health this morning to postpone these elections because of the actual situation with the pandemic.
And is that your decision, that you will postpone?
We always follow the recommendations of healthcare, of public health.
Je vais vous demander de répéter ça en français, s'il vous plaît.
I'll ask you to repeat in French. There were supposed to be some school elections for the school commissions, the English school commissions. Public Health has recommended today that we delay these elections, and we should accept that recommendation.
Good day. Facebook took down the page of Radio Quebec. Well, you know what it is. It's a channel that spreads conspiracy theories about COVID-19, that it's not dangerous, for example, and had about 80,000 followers. What do you think about this decision?
What I understand is it's because of Mr. Cossette-Trudel, who was involved on this page, but it's a Facebook decision.
Yeah, but what do you think about having Facebook taking that decision of this conspiracy? Well, they had Mr. Cossette was basically spreading.
But I don't like to see conspiracy on social media. So.
Because what can be the impact for public health when you have conspiracy theories spread on the web like this?
It's a real problem right now. Lucie Laurier, Cossette-Trudel, and those people saying that it's not true that we have a virus, of course it doesn't help to convince population to follow our guidelines.
CTV.
Mr. Legault, after what happened in the hospital of Joliette, there are calls asking for you to recognize systemic racism. Will you do that?
No, because right now, the Quebecers are divided in two groups. Some of the Quebecers think that there is systemic racism in Quebec. Another group, think that there's not. So I think our target and my objective is to try to have all Quebecers together fighting against racism. And we all agree that there is racism and we don't want racism. So trying to work at the Joliette Hospital, we'll try to make sure that there's enough training about cultural differences to make sure that all employees are trained to give same services to First Nation than to anybody else.
Don't think it's systemic.
I continue to think that there's not a system, of racism. Yeah.
C'est ce qui met fin au point de presse. Merci beaucoup. Bonne fin de journée.
That is all for today. Thank you very much.